Hi, everyone. Welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer, and I work for the Neurologic Wellness Institute here in downtown Chicago. Today's episode is answering the question, what are the benefits of virtual reality treatment? And virtual reality is kind of a new and upcoming field when it comes to treatment-based rehab. And it is something that we are very happy to have in our clinic here because it is very useful in treating multiple conditions. And virtual reality gives us a window into the brain that can do multiple things. We can either give us a sense of where our body is in space, whether that be changing how big our limbs are or may not be, giving us a better sense of 3D environment. And also, so that's more of like embodiment and spatial awareness, but it can also give us a more higher stimulating environment during treatment, which normally we can't really simulate in a typical clinical setting. And so it gives us many different variety of things that we can do for patients that don't really work in clinics that are just like, a table, or we don't really have multiple environments around. So I want to talk about a few papers and what conditions that can benefit from virtual reality. The first one is going to be about pain and chronic pain or many pain syndromes. And I'm going to kind of throw stroke into that as well, because that's more of that embodiment aspect. But then we also have anxiety and anxiety related disorders like PTSD and social phobia and other phobias, whether that be agoraphobia or phobias of heights or whatever it may be. And then the last one is going to be about traumatic brain injury, and specifically memory and cognition, and how virtual reality can help those with memory and cognition issues following a traumatic brain injury. So let's get right into it. And this first paper is on how virtual reality is important for embodiment and pain relief. And so this is an article from 2019 up there, and it's called Immersive Virtual Reality and Virtual Embodiment for Pain Relief. And so right away in the abstract, it talks about how virtual reality users have the feeling of being embodied within this virtual body. And using such virtual embodiment can manipulate body perception, basically how we feel about our body. And this has been basically allowed us to look at how people have altered body images in chronic pain. And so it talks about how it's an immersive virtual reality in the field of neurorehabilitation can help in this field of pain. So we know that basically embodiment is thought to emerge from a complex interaction of multiple signals, both bottom up, like from our body and our joint proprioceptors, our vestibular receptors, and our vision, but also top down signals from our cognitive centers of what we actually know our body to be. So here I kind of want to talk a little bit about embodiment here. I like this description. So it's the capability of our brain to have a representation of our body results in a mental construction composed of perceptions that we see, perceptions that we feel, and ideas about the dynamic organization of our body. And it's involving vision, touch, proprioception, interoception, so coming from our organs, motor control, and vestibular sensations. So embodiment is defined as a sense of having a body. And this is important because a lot of times with chronic pain, there is no longer a problem with the tissue. So let's say you have chronic pain in your shoulder. Here's a good description right here. Chronic pain where the symptoms last beyond normal tissue healing times. So generally the healing is already there. The healing in the shoulder is done, but somebody may still have pain. And that's generally because it's coming from the brain. And the brain has this poor perception of the shoulder, a poor perception of where the shoulder is in place, what information it's receiving from the shoulder, and then also maybe even how the shoulder and how like maybe they can no longer play baseball or reach up on the top shelf, how that can affect their life socially and emotionally, cognitively. And so virtual reality gives us a sense of getting into this window. It allows people to move that shoulder and do different tasks when they're involved in this virtual environment. And I kind of want to talk a little bit about stroke as well, because a lot of times stroke can lead to pain in one side of the body or one arm. And again, stroke is something that's up with, or something that's wrong with the brain. There was never an injury to the arm, but because there was an injury to the brain, that leads to pain in the arm. And what we can do is we can do different virtual reality therapies or mirror therapies even to improve sensation, improve awareness of that side of the body to bring down pain. So that's one article. Then we can talk about how virtual reality technology can be used for treatment of anxiety and other psychiatric disorders. So this one's from 2017. In the abstract, it says that VR allows for controlled delivery of sensory stimulation via a therapist and is convenient, cost-effective, right? Incorporating VR into psychiatric treatment of a wide range of disorders with a specific focus on exposure-based intervention for anxiety disorders. So this is for like people that get panic attacks when they're in front of multiple people. We can get them into this virtual environment of maybe speaking to a group while maybe they're really not, but we have this exposure while we can do other therapies with it. If people have PTSD, whether that be from a car accident or from being overseas in war, we can put them into a virtual environment that maybe stimulates that anxiety, that anxious reaction, but we can do other therapies to help tone it down. This allows us to do things in the clinic that normally we'd have to go to a place to generate a response. And that's the same thing for phobias, whether it be phobias for heights or for snakes or spiders. We can use virtual reality to help give some exposure and controlled exposure. So sorry for the scrolling here, but I just want to kind of show how this article talks about all the different studies. So specific phobias like flying, heights, animals, maybe needles or blood. Then we have social anxiety disorders. So anxiety about social interactions like conversations, meeting new people, public speaking. We can put people in these different environments. PTSD, I just kind of talked about that. Then we have panic disorder, agoraphobia. That's sudden rush of anxiety that's manifested by physiological, those heart palpitations, sweating, choking, cognitive issues. When people want to avoid specific places or situations. So we can put people in tunnels or in parking lots, on highways, driving, whatever it may be. Generalized anxiety disorder as well. Obsessive compulsive disorder. So those people that are constantly obsessing about certain thoughts, fears, and then they have compulsions, whether that be making everything perfectly straight or always checking the door when they multiple times before they leave to make sure it's locked. Schizophrenia, acute and chronic pain. This has that in here as well. Addictions, so we can work on addictions, whether that be smoking or drinking. And then I think there was one more, and eating, of course, so eating addictions as well. So this is a good paper to show all the benefits, the possible benefits and treatment options that we can use with virtual reality. And then the last paper is from 2013. And so relatively an older paper for virtual reality, which is a newer field, and which is kind of cool because virtual reality was used to look at prospective memory with acquired brain injury or concussions. And so prospective memory is the ability for us to remember and execute an action that's intended for the future. For instance, I go to work and I say, okay, I need to stop to pick up the kids and get some groceries, and I have this list. And so you go through all work, but in the back of your head, you always have, okay, when I go home, I have to do this and this. And a lot of people with brain injuries forget what they have to do in that future. And so this perspective memory can be improved with 12 sessions of virtual reality based cognitive rehab that's using everyday perspective memory activities. It significantly had better changes. They significantly had better changes in this perspective memory. That related to the cognitive attributes such as frontal lobe functions and semantic fluency. So ability to be fluent with obviously words. And so this is just a cool study, a cool clinical trial showing that virtual reality can be beneficial for people with memory and dealing with kind of like brain fog and focus concentration issues following concussions and traumatic brain injury, which is very common what we see. So to conclude, virtual reality is just this new field that has a lot of benefits for a lot of different type of patients. And we use it a lot. We use it every day. And there are many applications that are continuing to come out. They're continually trying to update, and we're continually trying to do more studies on virtual reality. And so it's something that if you ever get stuck in your health journey and trying to seek better health, seeking out somebody that can use virtual reality for your pain, for your memory, for your concentration, for your anxiety can really be beneficial. So if you like this, please leave comments below. Please let me know if you have any questions. I would love to hear suggestions for future topics as well. Thank you for listening today, and stay healthy.